So I kind of, so that's part of getting all those it's just satisfactory all on that first rubric. So I will not, I don't start timing you until you tell me you're all ready to go. So, and however you want to do it. So, of course I got to let you know today too. Hi, my name is Kristen, and I'm going to be your nurse practitioner today. And I see that you're in for your annual physical exam. So, okay, great. Is there anything else you had questions about today related to your physical exam, or nope, need prescription refills or anything like that? Nope. Okay. Well, that makes it easy for me. So, so then when we start, while we're talking, you can say I'm looking at the general shape. So I would have her take her clothes off. If we were having a real exam too. That's the other thing. So we'll just have to do some pretending piece. And then I would make note of if I'm seeing like a missing foot or ankle, fingers, because her color is pink. Her skin looks intact for the most part. And if I was seeing any lumps, bumps, scars, tattoos, this is when I would make note of all that. And then if it's possible, lumps, bumps, scars, tattoos, you can always measure it. A tattoo, you can actually, you used to be able to draw it on the person because the tattoo becomes an identifying object for individual. You know, if you watch those first 48 hours or something, they can always put stuff like that. I know, you'd be amazed. So don't laugh. So that's how we sometimes identify people, unfortunately. So then the next piece would be I'm looking, because I start at the top of her head. So I'm gonna, at any time during the exam, if anything causes you any pain or discomfort, please tell me right away. Because I really don't want to hurt you. And then and then to me, I always know if they laugh, that's a good thing, and laughing is okay. I don't mind doing that at all. So I'm going to start with your head, and you'll probably hear my fingers snap, crackle, pop a little bit. So don't panic. It's probably me, not you. So then I feel her head for lumps, bumps, divots. One time I did this, and a student had a divot right here. And turned out she'd been dropped in her head when she'd been like 10 months old, had a skull fracture. So yeah, she had a divot still in her head. So that was kind of interesting. And then you're also looking at color, you're looking at skin, you're looking, what do you usually find on the back of the neck sometimes, especially in kids? Lice, yeah. So creepy crawly things you're looking for too. So you want to make sure you have some really good light so that you can do all that. And then what I do is I go right into, here's her sinus. So this is the frontal, and then that was always the ethmoid, and the maxillary is right here. So that's good. And then I can palpate her preauricular area, post-auricular area. I usually pull on her ears a little bit. And then when I'm looking there, I'm looking again behind ears, front of ears, front. So I'm making a mess of her hair behind her ears for anything. Sometimes things live back there with people who don't have very good hygiene. So, and then I am, this is her occipital nodes that are back here. I'm doing all that. This was preauricular nodes, post-auricular nodes, submandibular, here's tonsil, and then submentals right here. And then you have a deep cervical here, shallow cervical. And then you have supraclavicular right here. So none of that should ever hurt. No lumps, no bumps, no pain. So that's all a very good thing. Yeah, palpate the nose. So it's bone here, cartilage here. This feels like a cervix, if you want to know that. That's mindless entertainment. So then, and then when I palpated her eyes, I went around the orbital bone. So I'm feeling for lumps, bumps, scleral white, conjunctiva pink. Do you have contacts in? I forgot. Okay, excellent. I was like, oh, I just did all that. So let's see. I'll do ears next. So then I already pulled on them and nothing bothered her. So then the next part is using your otoscope. Remember the light? Twists on till it can't twist. This one it's got light or dark right here, and that's all it is. So you can see it's nice and bright. She's over 3 years old, so we're gonna put it in, straighten it out. You can see a light reflex. You can see some hair that no cerumen. What is another word for cerumen? Earwax, yeah. So I usually, if you write earwax, I just go, ooh, you better start using cerumen. So their ears are nice and pink. Then I'm sorry, it's up to you. So, and then I use the same earpiece to look up a nose. So then I'm gonna have you lift your chin up, and then this is what I do. I have my pinky up here, and I have my thumb right on the end of her nose because I'm straightening out her nasal, and I'm oh, it's nice and pink, and I'm looking for what? Rhinorrhea or rhinoliths. Do you remember what rhinorrhea is? Yeah, rhinoliths are boogers. So that's why. Sorry about that. It's okay. So, and then if you want to, let's see, I gotta get my tongue depressed already. And then we're looking at her mouth. Oh, you can put your tongue there. You want to look at your lips first. So she's got pale pink. They look like they're might be getting a little dry. Yeah. And then if you want to take your two fingers, pull down your lower, yeah, and it's nice and pink, moist, no lesions, lumps, bumps. And then if you want to do the same thing on the top, oh, nice and pink, no lumps, no bumps, no lesions. Then you get to open up, and you want to look on the buccal mucosa, each side. Then can your tongue touch the roof of your mouth? Then you're looking underneath. Yeah, got it. Okay, and then stick your tongue out, and then can you say ah? Ah. Okay, when she says ah, that's cranial nerve 9, 10 would be if I wanted to gag her, and then she's got a nice pink throat. Her uvula's pink. It's moist. It's midline. No postnasal drip. Oh, and then teeth are white in good repair. So that is also very good. Now, cranial nerve 12. Do you remember which one that is?
Tongue symmetry.
Tongue. So when she stuck her tongue out and said ah, her tongue was what? Midline. And then can you move your tongue to stick it out again? Left, right, up, down. Can you roll it? Oh, see, I can't do that, and see how the kids love to do it. Then it's a great icebreaker for people. And then strength for the tongue is, push against there. Don't let me push your tongue. Don't let me push your tongue. You can also have her open up and do it with the tongue blade, but kids will chomp on the tongue blade, so that's why I don't use the tongue blade with that. So, all right, then. All right, we would have to, let's see, try to get it wider, but there we go. Oh, there. So you want to look straight ahead at the door, and then I'm shining the light on the bridge of her nose. It should be in the same place in both eyes, so that's the deer in the headlight look, also corneal light. And if you look straight ahead, this is cover, uncover, cover, uncover. Because if she can't see out of her left eye and I cover her right eye, what is a kid gonna do? They're gonna dance around my hand because I'm covering the good eye. So, and strabismus is what? It's weak muscles around the eye. Because remember, you have cranial nerves. Which one? 3, 4, and 6 that do eyes. So then I like to do, so for extraocular movements, if you can follow my finger with your eyes, don't move your head. Up, down, and what am I looking for? They should work together. There shouldn't be a lag. Just got a little nystagmus, but. And then what I love to do to the kids, you don't like that, do you? So no. The kids will like that and they'll cross their eyes right away. That's accommodation. So if you don't want to use that one, you can look at my finger and then look at the hand sanitizer. And my finger, and then the hand sanitizer. You gotta hold it a little bit longer. And then you can see the pupils dilate and constrict. So that's accommodation also. But for some reason, sometimes preschool boys have a hard time doing that. It's easier to do the other finger in. So I did. Oh, and then for extraocular movements, you can also do the H if you'd rather. So it's whichever one you want to do. It doesn't matter. There's really nothing. And then I was just gonna make you look for the red reflex. So you remember that? So probably I'll turn off your light when you do that. But you need to look straight ahead. And remember, it's patient's left eye to my left eye. If I do right eye, what am I going to do? I'm going to kiss her. See, as I come in, so you don't want to do that. So look straight ahead. Well, you'll probably all do it once in your lifetime, and then you'll never, ever do it again. So it's a great icebreaker, though.
I have a quick question.
Yeah,
so when
go
you
ahead.
shine a light on the bridge of her nose,
Yeah.
it's supposed to be the same in both eyes?
It's in the same place in both eyes.
Okay, the
Yeah.
light, okay.
Yeah. So then straight ahead, I'm looking for, and you can put this right on your face and you follow it in. And I've had way too much coffee. So on her cheat sheet, I know on the thing it's just got, you know, you see all that stuff back there, the macula and the optic nerve. I just go for the red reflex. And when we do eyes, we'll do more of that. So then straight ahead, because I have to do the other one yet. Got a beautiful eye back there. So she's got positive red reflex in both eyes. So then, and then I forgot to mention that when you are looking at them, I talked about sclera conjunctiva. They should be the same across and usually up above. The lids are intact. They're symmetrical. That's my favorite word. You can always use symmetrical when you have two of stuff. So that's a great word. And then cranial nerve 1 is what? Smell. So that's your nose. So we palpated already. I looked up there. The other thing is you want to see if it's open. So if you want to take your pointer finger, cover that. And then inhale, exhale through your left nair. Oh, that sounds junky. You sound stuffy. Do you have allergies?
No.
Okay, sound a little stuffy. So that's making sure that it's that it's patent. So, because remember, if it fits, it chips, it'll go up a nose, especially with kids. So you always want to be careful. So if a kid is 2, you would take a toilet paper roll, and if the toy goes through the toilet paper roll, it's too small, the toy for them. That means they could choke on them. So that's why they always say it's the toilet paper roll thing. And you'd be amazing how many, think of like Barbie shoes and all that sort of stuff. They would go right through there. If an older sib had a younger sib, there you go. So, all right, so we did eyes, ears, nose, mouth, neck. I usually go head to toe, so what I like to do is do the carotids. Temporal, thank you. So then I'm feeling for rate, rhythm, symmetry. So it's a nice pulse. So then I'm going to use my stethoscope, and I use which side? The bell, because I'm listening for what? Bruits, which are a musical sound. Oh, you've got one of these high-tech ones.
Sorry.
That's all right. So just pretend that's my bell, and then my bell. So that's good. And then you can do, then we're looking at her neck, and her, it should be skin is intact. It's symmetrical. There's no lumps, bumps, tattoos, piercings, that sort of stuff. Then when you palpate, you can palpate the tracheal rings, and it shouldn't hurt, so that's a good thing. And then on your checkup sheet, do they have you finding thyroid or not? I can't remember.
Displaced thyroid agitation to swallow.
So then it helps if, so when you do this, your patient should have water because it's sometimes hard to swallow when you're nervous. So you're going to tuck your chin down a little bit and then go to the right and then swallow. Great. And then you get to go to the left a little bit. You got to go this way with your head. Yeah, there you go. Then now swallow. So it should just slide smoothly. This really should be non-palpable. So thyroid issues oftentimes are an issue of what? Women over 40. So all right, so that's thyroid. Oh, then we have now we have carotids. So rate, rhythm, symmetry. Do I do them at the same time? Only if I don't like you. And so then again, we're using the bell side. So sometimes the book shows you doing it a couple times to find the best spot to hear, to auscultate. It should be nice, the same, should be the same from the temporal to the carotids. So, all right. Then I know I didn't do all my cranial nerves. We did 1. Cranial nerve 2 is usually the vision. That's where the Snellen would be for distance, 20 feet. Rosenbaum is for reading, 14 inches. Usually people need reading glasses or have presbyopia at what age, do you know? Between 35, 45, that's usually the infamous age. So if you make it through puberty without glasses, you'll make it to middle age. So there you go. All right, so then 3, 4, 6 we talked about. Then, and then we have, if you can open and close your jaw several times. Temporomandibular joint, so feeling for lumps, bumps, crackles, she doesn't have anything. Can you go side to side? Oh, there you go. Good job. And then now clench. So, ooh, that's her masseter muscle, so she's got a nice strong one. So cranial nerve 5, remember? And then don't let me open up your jaw. So that's good. So that's the motor part of cranial nerve 5. Now I'm going to use this for sensory part. So it's just a little cotton thingy. So you're going to close your eyes, and every time you feel me touch, say now. So.
No. 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 No.
So it should be the same throughout. So then cranial nerve 8 is the hearing. So you can do watch or whisper. I usually do whisper. So you're going to take your pointer finger in this hand and then either stick it in your ear, because preschool boys do that, or you wiggle your tragus. And then it says 3 feet behind, whisper.
1, 2, 3.
Okay. Then you get to swat. Yeah, see, look at this. I have a trained patient now. So.
A, B, C.
All right, so then she can grossly hear, so that's a good thing. Then, so that was cranial nerve 8, cranial nerve 9 and 10 we talked about. Cranial nerve 11 is your shoulder shrugs, so can you move your shoulder up, down? Okay, don't let it, and then push them up and don't let me push down. Okay, that's good. So sometimes some people will brace with their hands, so then I make them go, can you do this? And then can you scrunch your shoulders up? So that's another good one. So that's 11, and 12 was your tongue, so those are your 12 cranial nerves. So now we would be moving down, if I got everything so far, would be to move, you're down to the thorax. So again, you're looking at skin color. It looks like she's got some moles scattered. Lumps, bumps, piercings, tattoos, anything exciting? So, no. Then, so that's the inspection piece of it, and it should be, you're looking at the shape of the chest, and then one of the things you can do is the circumference. So I'm going to put my fingers, thumbs, right around probably about where your brow line is, and then have you take a big breath in and a big breath out, and you should have your thumbs equidistant. So you want to keep your hands at your sides, so you don't do this. So here, let me do back first. That'll be so back. So big breath in and then out. Okay. Then I might have to pull the girls out of the way. Pull your bra straps up. Yeah. There you go. Beautiful. Now a big breath in and then out. So they just move a little bit, but they should move the same, right? So, and then what else do they have besides inspection? Can I go to auscultate? Oh, palpation. So then what I like to do when I'm palpating the thorax is also I'm palpating the precordium. So that's what? The heart, basically. So for murmurs, thrills, heaves, or lifts, that's what I'm doing with this hand. And then I'm pressing as I go around. And then make sure you get the lateral. Remember, you have that right middle lobe. And then you're probably going to have to move the girls up for me again. Yeah. And then, right, you want to get the bottom part of the thorax right there, bottom part of the rib cage. So that was the palpating piece. So then I would auscultate. And what side am I going to use this time? Diaphragm, yeah. So if she's a 90-year-old lady, where's a good place to start when you do this?
Lower.
On the bottom, the base of the lungs, because what's going to happen as she keeps breathing? Yeah, so big breath into your mouth and out. Why don't you swing your legs over this way? We'll do this way. And you want to have a pattern, remember. So another one. And it's not a certain number, it's that you covered the distance. Because if you have someone who's 4'10" and someone who's 6'9" and a half, are you going to use the same number? Right. So that's your critical thinking piece. Okay. So she's clear on that side, and then if you want to scoot around that way so they can see him again. So again, you could start from the base again, and again, you probably just have them move the girls out of the way for me. So, and I would do this, of course, on the skin. I wouldn't do it through a sweater. So now big breath in, and again, you want to have the pattern. A right middle lobe, right up there. And do you have a left middle lobe? No, you don't. Because of why?
Cardiac, no.
Yeah, your heart takes up all that room. So I was trying to. So that would be hard. So she's clear bilaterally, right? Inspiration and expiration, anterior and posterior. Does that make sense? All right. Then for hearts, remember you have electrical and you have valves, right? So you're going to need to listen with what? Both sides of your stethoscope, right? So then this is where I use whatever cheat thing, or if you're so smart you can remember all this stuff. I can't remember it, so I use a pet missing. I talked about this last week. So second right intercostal is the A for what valve? Aorta, right. So then you go straight across to the left second intercostal space, and that's the P for pulmonic. And then the left third is our friend herb. So what does that tell you? You're just halfway down the heart, essentially. Then the left fourth is what? T. So it's tricuspid. And then the left fifth is usually what I use, but it's mid-clavicular. So that's going to be M of missing, a pet missing. So that's your what?
Mitral.
Mitral. It's also known as what else? Pardon?
The apex.
The apex,
Okay.
yeah. So you can, and it's also your apical pulse. It's also, some people know it as their
maximum.
PMI, point of maximal impulse. So that's why if you know like a 7-year-old skinny boy, have them take their shirt off and come from the side, and you'll actually see it fluttering because they don't have any fat on them yet. So it's great. You can just see it doing that because I did it with my nephew this summer. He's 5.5, and he's, you know, his pants, he has no hips. They just go south. So he's perfect. You can just see all that right on him. So that is sometimes helpful when you're trying to learn the spots. So then after you do it, then you got to go back and do it with your bell, right? The same thing. And on your test off, it's sitting and supine. And supine means you're on your spine. So, okay. So then usually that's what we go to next. So I would have her lay down. Usually take the pillow away. So if you told me correctly a pet missing when your patient was sitting, just, you don't have to verbalize it, just, you know, run through it and you'd be done. So does that make sense? You guys are all, don't panic. I'm like this when you do test offs too. I'm usually laughing most of the time. We don't have left lateral anymore, do we? No, because they took that out. So then it would be what? I would go to abdomen next. So then remember, it's always 2 views you have to watch for on the abdomen. So because this is, you know, like in a hospital room, you can't get to the head. So I usually tend to use the feet, and I'm looking for what? I'm looking for ripples, divots, pulsations, on either side. So, and then the usual scars, tattoos. Then you can also look at the shape of the abdomen. Do you remember those words? I love this. There's scaphoid, flat, rounded, and then protuberant. So sometimes that can be helpful too. So then the next thing after I'm done looking is I usually auscultate. So auscultate with 4 what? Vowel sounds, 4 quadrants. In Jarvis, it'll tell you which quadrant is the most likely that you will have vowel sounds.
Right lower.
Right lower, so that's sometimes a good thing to start right down there. You have how long in each quadrant? Up to a minute. It will seem like forever sometimes, so make sure you're timing yourself because 60 seconds can be a long time. And so you would be in each of those 4 quadrants. I'm auscultating vowel sounds. So I usually So my line is usually, are you okay with unbuttoning your pants and lifting your shirt? Sure. Okay. So again, tattoos, scars, you know, all that sort of stuff. Piercings, again, you want to make, she's got a couple moles, so you make those. And they look fine because they're smaller than a pencil head, so I'm going to smooth you up a little bit here. Okay. So then I have my line for my 4 quadrants. It goes through the umbilicus, so horizontal and vertical. Those are my 4 quadrants. So we've done it. Then you want to auscultate for what? Starts with the B. Bruits, right. So then you want to know your spots. Do you remember your spots? So I'm going to have to use my bell again.
In the middle.
Aortic. There's only one aorta. How many kidneys do you have? 2. So you have a left renal artery, right renal artery, right iliac artery, left iliac artery. And then remember you have those lovely femorals. And then you have to palpate too. And if you're not comfortable doing it on your patient, you can just show me on yourself. That's okay too, where your pulse points would be, and you palpate your inguinal area too. So then we have, I think, percuss next. So how cold are they?
That's okay.
Okay. So this, I'm right-handed. This is my hammer fingers. This is my wood. I use 2 fingers because on kids, I know Jarvis shows 1, but on kids, if I miss and hit them, they'll never let you do it again. So I use 2. So you have to have these 2 touching the skin, and this is where you're going to have to make sure that TV's off in the room. Ooh, what are we getting close to? Ear liver there. So you can hear based on where different sounds. So no problems. And then you're looking for palpation, and it's the light. How far does Jarvis say light should be? Yeah, and then deep is what? I know, yeah. But you know, when you have that 400-pound patient, 8 is not very far indeed when you're doing that. So the biggest thing is I'm usually blah, blah, blah the whole time, and I'm watching my patient's face because it shouldn't hurt is what you're looking for. So no grimaces, that sort of thing. If they laugh, you can bend your knees. Sometimes that will help because it softens up the abdomen so they can't give you too much grief that way. So, and then she's got you finding liver borders, right? So big breath in, and then push all that air out. And I can't feel it in her, which would be a normal finding. So that's a good thing. Then does she have you doing spleen? The measuring part? We're not going to do that. Don't worry about it. Okay, so I think I did abdomen then if I got everything. You want to zip up and button up? You can do that. Then you can sit up. And I didn't, and then swing your legs over here. CVA. I got to go the other way. Now, this hand should be flat, so it should be all connecting with the back. And then I hit, this is my hammer, this is my wood. So I do that. Should it hurt?
No.
I usually did this with my teenagers. They're like, ooh, keep doing that, keep doing that. I like that. So, then, then we can do, if you want to go this way again, I'm thinking we could do range of motion. Can you touch your chin to your chest, chin to right shoulder, chin to left shoulder? If you want to look straight ahead, don't let me push, don't let me push. And then if you want to stick your arms out, and then we can go up, back, down, cross, straighten, cross. Then you gotta go up, cross, straighten, cross. And then if you want to leave them out like this, don't let me push down, don't let me push up, don't back or forward. What kind of, you can put them down now. What kind of socket is your shoulders? Ball joint. Ball joint. What other joint do you have like that? Hip, right. So that's why you kind of want to pair it up when you're thinking about it. And then your elbow is what kind of joint? Hinge. So you want to go extend, flex, you know, that sort of stuff. Don't let me push, don't let me push. And then for wrists, you go in, and you go this way. So, there. So in, out, up, down, circle, circle the other way, leave them out. Don't let me push down, push up, push out, push in. Squeeze my fingers, but don't kill them. All right, great. And then I forgot to do this. I'm palpating for lumps, bumps, pain, that sort of stuff. And she feels nice. Starts out warm. She gets cooler as we go farther away. But it's the same bilaterally, and that would be an expected finding because your fingers would be cooler than your shoulders because why?
Peripheral.
You're farther from the heart, right? It's peripheral, so the blood's just got to pump farther. So I can do the same thing down here with her hips. So I'm palpating for lumps, bumps, warmth, tenderness, crepitus. Is she ticklish, all that sort of stuff. And again, she starts out warmer and is cooler, like way cooler on her toes. And then what I like to do when I make it down here is I do my pulses. Remember what's down here?
Complicated.
Yeah, pedal.
I mean,
Yeah, it's the other P word. Yeah. And then what's this one? Yep, and then popliteal. You can just tell me where it is because I can never find those either. I need an ultrasound. Femoral we did. And then what's here? Radial. Brachial. And you can do either above or I'll take either one. And we did carotids and we did temporal. So those are your pulses. And again, they are stronger the closer you are to the heart. Hence they get less as you get farther away from the heart, but they're the same across, which would be the good finding. And then we'll pretend she doesn't have nail polish on and she's got capillary refill that's instant here. So that means she's what? Perfusing. Then she's got nice pink nails up here too. Nice nails too, because what happens as you get older with your nails?
Come more brittle and stuff.
Yeah, and you can get what? Fungus, mungus. Yeah, so yeah. So oftentimes a lot of older adults, a good thing to do is just go to the podiatrist and cut them because it gets all skanky looking and stuff. All right, so then now we're going to do range of motion for hips. So if you want to stand up, this is one Dr. Shadwell did if you had her before, which is kind of cool. He goes straight. So I need to hold on to this. So you're going up and back, side, out, and then I do flex, extend, and then move your, do the same thing with your, and then some people can spread their toes. I can't do that, but I can curl them under. So then you have to do the other one. So then I'm going to flex, extend. I know. Can you curl your spread? Oh, you got those on. Spread your toes. I'm not a circus sideshow at all. So then if you want to turn around and look straight ahead, and then we're going to look at her back. You're going to feel my fingers touch because we're going to palpate the spine, but on either side. Remember, not on the spine itself. Again, nothing should hurt. Then you're going to pretend, you might have to scoot back, that you're diving into a pool. Oh, wow. No, you're good. You're very flexible. Okay, and then you want to tuck your chin under and then come up a little bit. Yep, there you go. And you can see it's nice and even. She's still doing all good. Okay, so you can go straight up, and then you're going to tip forward and then backwards. Then you're going to pretend you're a teapot and go to the right and then go to the left. That's good, because some people will start to cheat. They'll turn their hips and not, instead of going over the hip. So, and then we get to do gait. So if you want to walk over to the door, let your feet go anywhere. Then when you come back, you want to do heel to toe using that line there. Yep, it's the cock walk. Woohoo! Or tandem walking, they call it. Then if you want, yep, put your feet together, hands at your side, close your eyes. That is what? Romberg, because it's the sway test. So you have up to a ½ inch on either side to sway and still be called normal. So then if you would like to sit down, I know I have reflexes yet to do, so that's good. So that's your patella, right? So then that one went, right? Yep, there it went. So that is your Achilles, right? And then if we bend your arm, keep it in. See? Ooh. Ooh, cool. That's why I like to find the tendon. See? Right there. That one didn't go as well. Ah! Okay. Alright, then you're going to bend your arm. This is the scarecrow, so this would be your, what? You gotta rest your arm. Let me take the weight of your arm. Yeah. Okay. There's one. Tricep. So it might drive me crazy. And then you gotta rest your arm on my hand. Yep. Because that just means she's relaxing. Then if you want to put your thumbs together, I usually gotta relax. There you go. It's much easier if you can. Oh, woohoo!
Oh, and I fell.
Yeah, there you go. So that's the brachioradial, biceps, triceps. So we did all those. And can you tell me where you are today?
At UWM.
Do you know what the date is?
Wednesday.
Wednesday. Do you know what year it is?
2015.
Very good. Do you know who is Dean of the College of Nursing?
No.
Almost, it's really rare.
She's got Dean in her name, right?
Yeah,
That's
she
what I
does.
remember.
It's Sally Lundeen. So, okay, who's president of the United States? Yeah, there you go. So that's those ones. So then, now I have to do, I'm almost done. So, stereognosis and graphesthesia.
You're not boring me. I'm keeping my head down.
Okay. So I'm going to have you close your eyes, and then I need a hand, and you have to tell me what I'm writing there, what number or letter.
8.
Good. I'll do the other one. And
2.
Yeah.
Oh, it was
Good.
towards me. I
yeah,
was
yeah,
like,
yeah, because if you do it upside down, they won't know. So the other thing I sometimes do is do it this way, so that we're both the same direction for the number. So then if you want to close your eyes again, I'm going to put 2 different objects in your hand. You can tell me what they are.
That's the whatever you think.
The ding dong thing.
Yeah.
And then if you want
And then the reflex.
oh,
Yeah.
take that, buddy. Okay. So that's diagnosis. We did the questions. All right, what did I forget? Oh, the rapid alternating ones. So
Oh.
if you want to stick, then you go doot, doot, and then you want to speed up so I don't smack yourself in the, yeah. And then, or you can do this one, start slow, and then you go fast, yep, very good. And then you can, I like the one where you take your right, you're going to take your right heel, start at your left ankle, go up to your knee, and come down, yep, and then you go the other way. Yay! Now what did I have?
I think you did everything.
I'm getting better. Considering this was cold turkey.
Do we do it?
Thank you.
Our first.
Okay. Well, if you find something.
We're not worrying about the tuning fork at all.
No, I know. I was a peds nurse for how long, and a pediatric nurse practitioner. I never saw this done, but I guess once upon a time, one year, it was a NCLEX question. You guys are all past NCLEX. Otherwise, it's really something that's fallen out of favor because it doesn't. It's sometimes true, sometimes not, and doesn't say anything. So
With the assessing the coordination of the lower extremities, the heel to shin,
Yeah.
the one that she just did.
Yeah.
Is that one she has to do over and over, like a rapid movement? Like
I've just done one.
you just
usually,
did one.
It's
Yeah.
just the coordination.
That you can do it, yeah. Usually if you can't do it, it's like Romberg, they'll go right over.
That's what they
There's a
use in
problem.
the stroke scale.
Yeah. Mm-hmm.
NIH.
Yeah. So when you do, I can't even keep it straight, Web or Renee, that's, you're supposed to hear it equally on both sides, but that's not always valid. And then
We
with
heard it more on this side.
sometimes you can, if it depends on, did I hold it
In the right
equally
spot.
in the right spot, or was I drifting back and forth? So, and then I think it's Renee's. You should, on the mastoid process, you should hold it there, and you got to time it. And then when you tell me you can't hear it, then you do this. And so you should hear it this way twice as long as the other way. But you'll probably, I'd be surprised if you used it at all. So it's
So do you want us to do it or
I
not?
have it made just so you know what it is.
Okay.
So. Anything else? Any other questions?